So I'm another kidney doctor, but I look after adults with kidney problems in this place, which is the Southmead Hospital in the north of Bristol. So I spend half my time there looking after adult patients with kidney problems, and half my time in this building where we're involved in research. Nephrotic syndrome in adults is quite similar to nephrotic syndrome in children. It just happens in adults. So there are some things that are quite similar. So some of the things I'm going to tell you are similar to what Wen's just told you, but it's from a slightly different perspective, and it'll be useful revision. Okay, so this is nephrotic syndrome. You've heard this. Nephrotic syndrome is not actually a disease itself, but a syndrome in medicine is what happens when we notice a couple of things that happen together. So nephrotic syndrome is three things that happen at the same time in the same people. So one is lots of albumin or protein coming out in the urine, and that can give you frothy urine like that. The second thing is this edema, we call it, or swelling. So swollen legs, and particularly it's pitting edema. So if you press on it with a thumb and then take your thumb away, you can see that there's a dent there. So that's the second thing. And the third thing is low levels of albumin in the bloodstream. And we can find out about that on a blood test. So when those three things happen together, we call those three things being together a syndrome, which is nephrotic syndrome. And nephrotic syndrome is caused by a problem in the kidneys. But there can be a number of different problems in the kidneys that can actually cause this nephrotic syndrome. So the nephrotic syndrome is a syndrome caused by different kidney diseases, if you like. So the key to all this and understanding nephrotic syndrome and understanding what we can do to treat it and put it right is to we have to know to start with what goes wrong with the kidneys in the conditions that cause nephrotic syndrome, so we can then work out how to try and put them right. And the key thing about the kidneys is that they've got lots of blood vessels within them. So blood vessels are tubes that carry blood into the kidney. And the reason why the kidneys have got so many blood vessels is because it's the job of the kidney to clean the blood. So obviously the kidney needs to get lots of blood if they're going to clean the blood. So about 25% of all the blood that's pumped out of the heart goes through the kidneys. So every time the blood goes around the body, about a quarter of it goes through the kidneys, and that's so that the kidneys can clean the blood. So the kidneys are full of tubes carrying blood. There's a big one that goes into each kidney, and then the big one that goes into the kidney divides into smaller ones, and then smaller ones still that get really tiny and microscopic. And at the end of these tiny blood vessels, you get these little balls of blood vessels, which are called glomeruli, and it's almost like a little ball of wool, a little tangled ball of string, that are called glomeruli. And these are actually the filters within the kidney that actually do the job of filtering the blood. So the blood comes in a big vessel, it branches into lots of tiny blood vessels, a bit like a tree, and at the end of those tiny blood vessels are these balls of even tinier blood vessels, which are the kidney filters. And there are about 1.5 to 3 million of these tiny microscopic filters in each kidney, and that's one on the right. That's a bigger view of one of these balls of capillaries. And there's about 19 kilometres of these tiny blood vessels that are in each kidney. So there's a massive amount of these kidney filters that do the job of filtering the blood. And as we've heard already, the tiny blood vessels that are in these filters are covered by two very important types of cells. On the outside, there's what we call the podocyte, which is the cell that's a bit like an octopus. And on the inside, there's cells called endothelial cells, which line the inside of the blood vessel, and they have these little holes here, which also allow filtration of the blood. And these kind of cells are a bit like fried eggs, because they're quite flat cells that line the inside of the tubes, the blood vessels. And even on these fried eggs here, you can see there are lots of tiny holes through them. So this is a good sort of illustration of this type of cell. And these tiny cells are important for letting through water and things that the body doesn't need. So this is what one of those glomerulus, the kidney filter, looks like if we cut it through the middle. and we can see that there are these tiny tubes. These capillari here have got the endothelial cells, which are yellow on the inside, and the podocytes, which are green on the outside. If we look at even higher magnification, so this is now one single tiny blood vessel in the filter. Again, you can see the endothelial cell with these holes on the inside, and then the podocytes with their foot processes, these ones that Gwen has already shown you, on the outside. And this is an electron microscope image of the same thing. So this is now just a small section of the wall of one of these tiny tubes inside the kidney filters. And again, we can see these two types of cells. This is the endothelial cells on the inside and the podocytes on the outside with these foot processes. And together with these two cell types and the thing that's between them is called the basement membrane. Together, these three things are what actually forms the filter in the kidney. And every day, through all these several million glomeruli, about 180 litres of water passes across this filter. Okay, most of it's reabsorbed back into the bloodstream in other parts of the kidney. But every day, these filter 180 litres of water. But this is the clever bit. The water comes out, and also small waste products of the body from the bloodstream comes out across here and then goes into the urine to be taken away. But the things the body needs, like blood cells, which are big things, and big molecules like proteins that the body needs to function, they stay in the bloodstream, so the bloodstream is up here. So that's what happens in normal life. Lots of water and small things, but the big things the body needs, blood cells and proteins, stay up here. So what goes wrong in the conditions that cause nephrotic syndrome is that this filter starts to become leaky. So instead of keeping all the protein in the bloodstream where it should do, this filter becomes leaky and more protein comes across into the urine. Okay? So you can see from this that how the two cell types, the endothelial cells and the podocytes, how they're performing, how they're working is really important to keep this filter going. And if one of these cell types suddenly is not working properly for some reason, then you start to get this leak of protein out into the urine and you get nephrotic syndrome. So what does nephrotic syndrome look like in adults? It's still a rare condition in adults, not quite as rare as in children, about one in 30,000 people per year. That doesn't sound very many, but it's actually still a major type of kidney problem, because kidney problems themselves are not that common compared to things like heart problems or cancer or something like that. Kidney problems in general are much rarer, but in terms of all the different types of kidney problem we see, nephrotic syndrome is a very important component of those. And working up at Southmead, so at Southmead Hospital, our patch is Bristol, but also down to up nearly to Gloucester, to Bath, down to sort of Yeovil, down to sort of Taunton, all that kind of area. And from that patch, we probably see 1 or 2 people a week, so maybe 100 people a year, something like that, who come to us with a new diagnosis of nephrotic syndrome. As Wen has already told you, we can divide the causes of nephrotic syndrome into three sort of categories. One is primary, so this is things that specifically affect the kidney. So it's a disease that's just affects the kidney and not some other part of the body. Secondary is, we call nephrotic syndrome secondary when it's a disease that affects other parts of the body or the whole body, and the commonest one might be diabetes, that also affects the kidney. And the third type is genetic disease, which is caused by some gene mutations, and nearly all the time, if there's a gene mutation, it becomes apparent in childhood. So those are the kind of causes of nephrotic syndrome that become obvious when someone's a child. So it's very unusual, hen's teeth, that we actually see someone coming to a doctor for the first time as an adult with a genetic disease. So I'm not going to talk about that. I'm going to talk about primary and secondary disease. So the kind of things that cause primary nephrotic syndrome in adults are the same as the things that affect children. but there's also a few other conditions as well that are in there. So the first two are the ones that Wen has already talked to you about and happen in children. So minimal change disease is generally sensitive to steroids, and that means it doesn't mean they get all emotional when you give them steroids. It means that when we give them steroids, it gets better. And FSGS tends to be more steroid resistant, as in when we give steroids, it doesn't get better. And then there's a few other types of condition that can cause nephrotic syndrome in adults. One called membranous, another one with a very long name that we shorten to MPGN, and another one called IgA nephropathy. And there's a few other rarer ones, but those are the main primary diseases that just kind of focus on the kidney. And then we have the secondary causes of nephrotic syndrome, which are other diseases affect the whole body that also affect the kidneys. So diabetes would be the commonest one, and diabetes is the commonest cause of nephrotic syndrome in adults. Sometimes certain types of infections can affect the kidney and cause a nephrotic syndrome. Drugs, it's unusual that drugs that are given to people by a doctor or prescribed drugs cause nephrotic syndrome. That's very rare, but sadly we quite often see or we see increasingly frequently people who have been using injecting drugs for recreational purposes presenting with something called amyloidosis, and this is a sort of a scarring up of the kidney that happens in people who've been living that kind of lifestyle. And there's also other conditions, something called SLE, which is systemic lupus erythematosus, which again affects lots of different bits of the body, but the kidneys affected too. So what are the effects and consequences of nephrotic syndrome? If you've got nephrotic syndrome, how do you feel? Well, generally people feel lethargic because losing all this protein into the urine means that the body has to madly try to replace it, so the liver is busily trying to make lots more protein to replace all the protein that's leaking out into the urine, and that tends to make people feel quite tired and lethargic. People get swollen up, so they might have swelling in their legs or their body. They start to feel sort of a bit heavy and a bit sort of like Michelin Man sometimes, and people might notice the frothy urine and even some people become breathless because they get some of this extra fluid inside their chest. And the consequences of nephrotic syndrome, people with nephrotic syndrome are more susceptible to infections, like a skin infection or a pneumonia. They're more susceptible to blood clots. They get high cholesterol, should be cholesterol. And importantly, these conditions that cause nephrotic syndrome and cause the leakiness of these filters can eventually cause scarring of the filters so that they can't filter properly anymore, and then you get kidney damage, and if it's not treated, eventually it can lead to kidney failure, and of course that's what we're trying to avoid. But sometimes, sadly, in people with nephrotic syndrome, we're not able to treat it successfully, and it does continue to the point where the kidneys actually stop working and not working well enough to keep someone healthy. And in that situation, we've got some other treatments that we can use. This lady's having dialysis treatment, which is a machine treatment to clean the blood, or transplantation, which is obviously giving someone a new, fresh kidney. But of course, we want to avoid getting to the point where we need to use those treatments, and that's why we're all here involved in this research, to try and find better treatments for nephrotic syndrome to stop things developing to this level. So what do we do when someone comes to hospital saying their legs are swollen and they've got frothy urine? Well, we do what doctors do, which is do some blood tests and some urine tests. We measure the amount of protein that's coming out in the urine. We measure the amount of protein in the bloodstream, and usually we find it's gone up in the urine and down in the bloodstream because it's all leaking out. We can do specific tests for certain conditions, so if we suspect diabetes, we can do a blood test for blood sugar, for example. But the test we often need to do is a kidney biopsy, as Wen's already mentioned, which is taking a tiny piece of kidney out with a special needle and looking at it under the microscope, so we can see these kidney filters under the microscope and see exactly what's going on with them. So this is just one example. On the left here, this is a normal kidney filter, and you can see that there are these capillaries, which are the small tubes that we can see sort of end on. That all looks normal. On the right, this is a kidney biopsy from someone with diabetes, and you can see they're quite different. This one is filled up with these sort of balls of collagen that Wen's already mentioned that stop the filter working properly. So what can we do? How do we treat people who've got nephrotic syndrome? We can do some simple things like asking people to eat less salt. We can give people water tablets, and these are tablets that encourage the kidneys to get rid of that extra salty water that accumulates in the legs and around the eyes and so on. And then we can give some treatments to try and actually repair the kidney filters and stop the damage going on. And the commonest treatment we use is steroid treatment or prednisolone, which in a number of these conditions is effective at stopping the protein leak. But the problem with steroids or prednisolone is they do have side effects, which can cause problems, particularly if they have to be used in the long term. And the reason they have side effects is because steroids don't just affect the kidney filters, but they affect all kinds of different parts of the body. And what we really need is more treatments that just focus on the problem in the kidney filters without affecting the other parts of the body. And again, that's why we're focusing on these kidney filters and the cells that are in them to find out what goes wrong with those cells, and therefore what exactly we need to do to put them right, and what treatments we can use that would just put those cells and those filters right without affecting the rest of the body. I'm just going to mention one other thing we work on here that's on the fried eggs, the endothelial cells. So this is that cross section of the kidney filter again, with the endothelial cells on the top and the basement membrane, then these podocyte foot processes. On top of the endothelial cells is a special lining called the glycocalyx, and this is a sugary sort of gel-like layer that goes right across the endothelium and right round the inside of every capillary. And it's almost like a sort of fur coat, if you like, that's on top of the cells and lines the capillary. And we can study this fur coat in the cells in the lab. Again, these are the fried egg cells, and you can see the green up here is the fur coat that's almost like a lawn over the surface of the cells. And this fur coat is part of the filter that stops all these proteins coming across. Another way of looking at this fur coat of glycocalyx is it's like a forest. A normal healthy forest looks like this. It's got lots of different sort of healthy trees in it. And then in certain conditions like diabetes and other conditions, this is what happens to the forest. It sort of gets devastated. All the trees are blown over in this case, and then it doesn't function so well as part of the filter. So what we're trying to do here in one part of the research we're doing is find ways of making this forest grow back, protect it, stop it being damaged in the first place, so that it can play its part in those kidney filters and stopping the protein coming out from the bloodstream into the urine. So that's all I want to say at the moment. This is just showing some of the people who work in the lab and who work here, and on this side some of the people who fund the research here, particularly Kidney Research UK, who are one of our main funders and who enable this work to happen. Thanks very much for your attention.